Hello, my name is Joanna, and I am one of the clinical informatics nurses, and I am going to go over the December 2022 TouchWorks Education. First, there have been two code changes listed below. For order changes, the SIU only referral orders, there has been a pick list added for the performing location of just the appropriate referral locations, which are the SIU Decatur referrals, SIU Springfield referrals, Springfield Clinic referrals, Orthopedic Center of Illinois, and other which should be used when referring to memorial care. For the Holter monitor orders, the extended 3 to 7 days and the 8 to 15 days, the question of how many days should the patient wear the monitor has been updated on both of these. The antiphospholipid A/B panel uh, order has been updated to include the specified orders within the order instructions. For the SIU only colonoscopy orders, for all GI sites, the default performing location is going to be Memorial Medical Center. Also, the CPT code question and free text field have been removed. For the UGI with small bowel order, the financial auth needed and a scheduled appointment needed have been added. For the temporary deferral, the reason for pending insurance authorization has been added. COVID-19 by PCR TAC path has been inactivated. Under instruction order update, the patient instructions have been updated for the depression counseling provided order. There are a few new orders listed below. For the first one, the new resultable procedure orders, this will be used by the care coordination team, and that's the SIU only care coordination intake and the SIU only care coordination follow-up, and these results will go to the SIU care coordination flow sheet. For the X-ray order changes, both the X-ray aspiration hit by rad left and right have been removed. And below are the X-ray orders that have been added or renamed in TouchWorks. We have made a few changes to the notes to help with the amount of time it takes for the note to load. We have removed the check boxes from all notes. So that is the SIU family history reviewed, the social history reviewed, and the past medical history reviewed. We also have removed the social history, past medical history, surgical history, and family history from all established office notes. These will not be removed from new patient visit notes, pre-op visit notes, or notes that can be utilized both for new and established. As you can see in this office note on the left-hand side that the histories have been removed, but over here on the right under the problem tab, you still are able to see the past histories as well as add new or change any histories that need to be edited. For vitals change, the SIU only has been removed from the PHQ2 questions and score. For medication administration, the Pure Apply has been added. There have been changes to 2 pharmacies. The scanned and controlled substance agreement will now be found under the privacy tab. Again, here we have the SIU only care coordination intake and follow-up, which will now flow into the SIU care coordination flow sheet. Each department has been built a on hold overdue work list that will contain orders on hold for temporary deferral, missing information, financial authorization needed, and scheduled appointment needed. And this should be worked like any other overdue order work list. The problem list. So again, we are trying to clean up the problem list. These acute problems will resolve and go to the past medical history, or they will auto resolve and suppress, and they will not be viewable in the problem list or on any histories. On the right hand side, you can see the number of days before they auto resolve, and this is going to help clean up problem lists for reconciliation purposes. For the desktop view, the new standard desktop view, it was found that users were unable to default their chart viewer. This has been updated, and you are able to have the standard view, but also have your chart viewer be your preference um, view. And if it is defaulted to none, if you just reach out to your CI nurse, they will be able to help you. DB Motion is upgrading and will go live December 12th. The functionality will not change. It will mostly be a cosmetic change with different icons. But there will be more information about this upgrade closer to the go live date. And then attached, we have standard guidelines on the time frame in which an incoming request that is entered into TouchWorks should be handled. This will be used by the call center and front desk when recording incoming tasks. So as you can see, we have the task type, a little definition, an example, and the urgency that it should be sent as. For our December 22 helpful hints for the tasking reminders, please do not send any tasks to providers with exiting in their last name. These providers are in the exiting process and no longer see patients in that location. And please do not remove any task. If you've completed a task, you should select done. If you are unsure what to do with a task, please reach out to your CI nurse before removing to have them help you. The prenatal upgrade took place on November 30th. It has the ability to record gestational diabetes in the medical history have been added. Orthopedic Center is rebranding. So Midwest Imaging has been changed to OCI, MRI, and imaging, and Midwest Rehab has been changed to OCI therapy. Then below the Athena IDX to TouchWorks interface, we have the patient status locations and the preferred pronouns. If a status needs to be cleared from TouchWorks, just enter none in IDX to send over an updated interface message into TouchWorks to clear the previous status. And then below is the HealthWise patient education updates below. And that is all I have. Thank you.